Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today our topic of discussion is about an autoimmune disease which affects multiple organs in human body. Yes, today we are going to talk about Vogt Koyanagi Harada syndrome. We will discuss the benefits of early treatment, and if the early treatment is delayed, what are the possible complications we can face during the course of treatment. This disease usually affects female patients in the age bracket of 30 years, and the patient presents with, in acute phase, headache. He will have tinnitus, maybe vertigo, blurring of vision, all these classical features of, as I mentioned, about meningismus, they will be there. So, apart from the eye point of view, if we talk, it affects skin, it causes vitiligo, it causes whitening of eyelashes, alopecia. It also affects inner ear, patient feels tinnitus, vertigo. It affects the meninges of the brain and spinal cord. Typical features, as I mentioned, meningismus, fever, neck stiffening, headache, all these, because multiple organs are being involved. But when we talk about human eye, there are also pigment layers, RPE layers, pigments, and there it causes granulomatous inflammation, granulomatous uveitis. It also causes multiple areas of exudative retinal detachment, so that after this disease, the patient develops yellow appearance of the fundus that we call sunset glow fundus. And if not properly treated in time, the patient can develop severe complications. The complications usually go up to the cataract, glaucoma, choroidal neovascularization. So all these things happen over there if proper intervention is not done. Whenever we try to make a diagnosis of this disease, we should keep in mind some very important factors. At least 3 of these following should be there. Number 1, neurological features, as I mentioned, neck stiffness related to the meningismus. Auditory features, tinnitus, vertigo, chronic iridocyclitis, exudative retinal detachment, sunset glow fundus, and no history of trauma. The patient must have at least 3 of these positive features to make a diagnosis of VKH. Yes. So if we see at this photograph, there are multiple areas of exudative retinal detachment which are shown over there. And along with this, if you look at the OCT and FAS, there is central exudative retinal detachment, and along with this, there is fingerprint pattern. This fingerprint pattern is basically the stretching of outer plexiform layer and Henle's nerve fiber layer. So these are the important features which help us in the diagnosis. If we talk about diagnosis, indocyanine angiography and OCT are very helpful in these patients. If we look at these photographs, there is central exudative retinal detachment. In angiography, there are pinpoint leakage areas. And in indocyanine green angiography, we can also see black hypofluorescent dots, which are basically choroidal granulomas. So these are the classical features which should be kept in mind when we are doing diagnosis on the basis of the images. Talk about the OCT. These patients, we can see here that there are subretinal fluids, septa, hyperreflective dots over there. Choroidal thickening is increased. Yes. And B scan also shows here exudative retinal detachment. Treatment is the same. We can give IV steroids for a few days, followed by oral steroids course, tapering dose. Plus, at the same times, immunosuppressants can be given like mycophenolate mofetil, cyclosporine. But all these things are done by ocular immunologists, the people who are trained in this field. The two things very important to be kept in the mind. If we start treatment before anterior segment inflammation happens, the results are very good. I mean, there is no iridocyclitis, no capes, no synecdoche formed. Then the chances of improvement are very high. But once inflammation comes into anterior segment, the treatment has been delayed. There are synecdoche, iridocyclitis, inflammation, capes, cataract. After that, if we start the treatment, we have seen that patient results are not that much responsive. So this is a very important point. Before the development of anterior chamber activity, intervention should be done. But the question arises, why this delay happens usually? Usually, the physicians can confuse this disease with CSCR, yes, central serous chorioretinopathy, which we have discussed in our earlier videos. And in this CSCR, we know it is most of the times it is self-limiting. And if that is delayed because physician thinks this is CSCR, we can wait for it. And after that, the patient develops all these anterior segment inflammation, synecdoche, iridocyclitis. Then our treatment is not that much effective. So this is number one point. And secondly, as I mentioned, its differentiation from the CSCR is very important. So this was our presentation of today, VKH. It's a multi-system, multi-organ disease which can affect skin, brain, inner ear, and also eyes. Autoimmune disease, and this can be managed very effectively provided the treatment is done within time. I hope my today's presentation will be beneficial for my audience. I want to thank them for their attendance and attention. Thank you.